Okay. So, a very hearty good afternoon and welcome to our session on the topic Tips and Advices for a Seamless Pregnancy. We are glad to have Dr. Karthiga Devi with us today to help us understand the topic. So, if you have any doubts, any queries related to the topic, you can drop it on the comment section and our doctor will take it in the last of the session. So stay tuned till the last and also be there and drop your questions so that the doctor can also take it some other time whenever we come across your Facebooks and YouTube comments. So just drop it down. And ma'am, you have the stage now.
Hi. Hi, good evening, everybody. This is Dr. Karthika Devi. I'm a consultant gynecologist, obstetrician and gynecologist in Apollo Cradle Hospitals, OMR, Chennai. The topic given to me is how to have a seamless pregnancy throughout. So it's a very basic topic, and but then I thought even now, lot of women, when it comes to first pregnancy, especially, they are so scared. They're so scared how the pregnancy will be, whether it will be a complicated. When they treat this pregnancy as such, it's such a humongous task, to undergo. It's basically not that. Pregnancy is a very happy situation. The very reason I selected, to be an obstetrician is it's a happy field. You come happy and you leave happily. That's why I even selected obstetrics. So pregnancy is such a thing. It's not that all pregnancies will be a complicated one, and pregnancy as such, it's not a complicated thing to handle with. So, to start with, the thing seamless pregnancy without any complications, it doesn't start once you're it starts even before you become pregnant. That is how to even plan a pregnancy. Before, we used to say that once you are planning a pregnancy, go please visit a gynecologist or your obstetrician. But now it's one step ahead because of the like the type of lifestyle we need, the type of food we take, the type of pollutants we are exposed to. There are a lot of diseases we are exposed to, and because of a lot of knowledge, Google is free for everybody. We are already will be having a lot of ideas and doubts about a lot of things. So now, if you are planning a pregnancy itself, even before planning a pregnancy, I mean, go visit your doctor and ask them when to plan a pregnancy, because each individual with the different age groups with different diseases or pre-existing medical conditions, they'll be needing different types of advices, and so each individual is different. That we have to understand first. So go as a couple, once you are married, go visit a doctor for a general health checkup and ask them when you can actually plan a pregnancy. That is very important. So if at all you're planning for a pregnancy, if at all you're taking medications for something, your doctor will ask your not just your history, your family history and your medical history, your husband's side history, everything, and they can help you out with a lot of tips. So this is about even before planning a pregnancy. So once you start, like after a couple of years of marriage, you're going and visiting somebody. Since if you're planning for a pregnancy, when you're planning for a pregnancy, it's 100% mandatory to visit an obstetrician. So once you visit your gynae, if at all, that's important because people, it starts from our physique. If at all we fall in, like a high BMI group or low BMI group, if you're very obese or if you're very thin, a lot of women now we have a multivitamin deficiency, B12 deficiency, particularly vitamin D deficiency, or if we are taking any medications, like for PCO or metformin for PCO, or any if you have a diabetes, hypertension, any other pre-existing diseases also, we need to visit the doctor and get few tests done to correct any deficiencies if at all you have, if including thyroid also. Otherwise, if you'll be taking few medications already, so those medications can be changed to like medications which are safe during pregnancy. Because when we confirm a pregnancy, we are already 4 weeks by dates. So that important organogenesis period starts during this 4 weeks time. So sometimes in irregular periods, people, we don't even know when actually which day, which will be the correct date of a pregnancy, which will be the correct date of delivery. So if we change the medications already when we are planning for pregnancy, and if we start taking supplements like folic acid medications, multivitamin, including your vitamin B12 and all, calcium, all these things. If we take like prenatally, definitely it will be a very it will make a very big difference in planning a pregnancy and in the first trimester of your pregnancy. You'll be fit to become pregnant. That is very important. Now, once you become pregnant, once after you confirm your pregnancy, lot of people even now they have the habit of like postponing their first postnatal visit, I mean the post conceiving visit, some 8 weeks, 9 weeks, like that. You cannot do that. I understand that our first scan falls at around 6 to 7 weeks. A lot of doctors even now, if the patient is asymptomatic, they do the scan only by around 8 weeks. The first dating scan, I mean. But there are certain conditions, as I told you, the medications can be changed, or thyroid, for example, even if you don't have thyroid before your pregnancy, or if you have thyroid, your thyroid values tends to change in the early trimester. That is even before you confirm your pregnancy. So some doctors, we change a little bit of alterations, little bit of change, that may be up and down of your the thyroid medications. It can actually prevent abortions. It can actually lead to a healthy formation of a healthy embryo. That's very important. It can prevent some type of neural, I mean, nerve or related type of abnormalities and all. So that first visit, don't postpone it till 7 weeks or 8 weeks. Once you see your urine pregnancy test positive, or once you do a blood test and once it is confirmed to be a pregnancy, go visit your doctor immediately. Get the initial blood test done. Date your scan. It's not necessary you have to have a scan immediately. Date your scan, or if it is necessary, your doctor will tell you when whether you need a scan immediately. She will examine you and she'll tell you. So all these things can be put, can be done in the initial first visit. So my first point would be, please don't delay your first visit to your obstetrician. Number two, once you've been to an obstetrician, they would have done a scan. All these things we all know. We all know about the dating scan, all the scans. So apart from that, I'm going to tell you about very important things, usual things, but then very day-to-day life, what all we have to do to have a seamless pregnancy. Number one is how to eat during pregnancy. See, the whole pregnancies, we need to eat nutritious food, lot of veggies, lot of fruits, provided you ask your doctor how your sugar levels are. You need to avoid few fruits. You need to avoid few things. All these things are okay, but then lot of veggies and fruits according to your glycemic index, that is your sugar control, proteins, minimal carbohydrate, that is your whatever carbohydrates you are allowed to take. Apart from that, plenty of water, staying hydrated, and avoiding certain foods throughout the pregnancy is very, very important to have a healthy pregnancy. That avoiding comes, like we say, ripe, I mean, papaya, pineapple, jackfruit, and apart from that, some sort of sea fishes. And apart from this, very important is any type of ready to cook foods that has any preservatives, pesticides, and anything which has a shelf life of more than 3 months definitely will have preservatives or pesticides. And food which has been cooked like the previous day, don't reheat your food and eat, particularly when it comes to non-veg. And apart from that, anything which has artificial masala, that includes your artificial colorants, Ajinomoto, MSG, something which looks very artificial and very colorful to us, it's better to avoid those type of foods during pregnancy. And coming to fluids, we understand in the first trimester, a lot of people, you will have vomiting, you will have nausea. Just little by little, whatever type of fluids you take, it might be like juice, milk, or tender coconut water, soups. You see to that you take some 2 liters in intervals. Also, it's okay. And if you want, you can take help from your doctor and take antiemetic medications, and then keep yourself hydrated throughout the pregnancy. Particularly in some, we are heading towards summer now. If your hydration is not good, naturally our amniotic fluid, the medium which is very important for the survival of the baby, is going to go down. And apart from that, the circulation to the baby itself is going to be compromised. So fluid intake is very, very important. So I told you how to eat. Well, obviously, we'll drink water, so keep yourself hydrated, and definitely not just during the first trimester, throughout the pregnancy, avoid smoking, drinking alcohol, and any type of substance abuse, including drug abuse. There is no such thing called safe amount during pregnancy in these things. That is very, very, very important. No, this much of the social drinking or one puff or even passive smoking is also kind of smoking. So please stay away from people who actually smoke also. Particularly in corporate setup, a lot of people, we are forced to, like share a room where people smoke. So please get out of that room and don't, like subject yourself to passive smoking too. So that is also important. The next thing is exercise. Exercise is, we all think exercise is something, like we'll be doing only for a safe, for normal delivery. Otherwise, I'll end up in cesarean. It's not like that. Whether you are pregnant or not pregnant, it is compulsory, it is mandatory that we all should be having some type of physical activity, some type of physical exercise in our routine. That applies for every single human being, even in children. That's what WHO says. So when we are pregnant, particularly when we are talking about pregnant women, when we are pregnant, your exercise starts from day one. But there are some exceptions. If you already have, like a bad obstetric history, whether you have had some abortions before, or whether if at all yours is a very precious pregnancy, or you have had a condition called cervical incompetency in your previous pregnancies, of course your doctor will tell you when not to exercise. Saying that other than that, all low risk women should definitely have some type of exercise that can start with mild walking, and then once your scan confirms that everything is okay, your placenta position is okay, you can even do brisk walking, you can do swimming, you can do yoga, even now the squats, whatever your prenatal, there's some classes, prenatal classes is teaching them, antenatal classes are teaching them. Any kind of exercise should be there. Exercise or whatever should be in a form to increase your fitness. It's not that today I cleaned my room. It's not that I know I went for a walking in my terrace or went maybe walking inside the house. It's not like that. It should be challenging your, like a physical capacity. You should go one step beyond that, within safe limit of your doctor allows you to do certain form of exercises. So exercise is very, very, very important when it comes to seamless pregnancy. Then only you can be fit, have a normal delivery. Apart from that, you can be a fit mother too. When your fitness level goes down, if you don't do exercises, your fitness levels goes down like anything, and you cannot even nurse your children, I mean your babies properly. You cannot take care of them properly. You become very tired. So exercise gives us that fitness also. So apart from that, the next point is don't miss your iron and calcium supplements. Sometimes you'll be taking thyroid medications, diabetic medications, including insulin, your BP medications. So don't ever skip your medications. Don't ever skip your doctor visits, your ultrasound scans. There are only 4 to 5 scans we'll be doing. So don't do, certain scans should be done at that point of time, because we can, after some time, if at all, for example, that NT scan or first trimester screening test can be done only in first trimester. You cannot come back at 16 weeks and you cannot tell that we forgot a scan. So whatever date your doctor is, like scheduling for your scans, particularly your first trimester screening test, your anomaly, your target scans, and your interval growth scans. Don't miss your doctor visits, don't miss your scans, and don't miss your blood test. That includes your sugar test, your anemia profile, your blood profile, your vitamin D, everything. And other than that, important points I wanted to tell you is Googling. That is, say pregnancy, as far as much as it's a very happy condition, when we Google a lot about our, pregnancy, for example, there are a lot of patients who come back and ask us weight of the baby as early as 12 weeks of pregnancy, as early as 14 weeks of pregnancy. See, when you Google, there will be a lot of unwanted information available on the net. Our mind is something which is more attracted towards negative energy and negative news. We don't think only the positive things. We take a lot of negative news also, negative information also from the internet. So my humble request for all the going to be and already pregnant women is, please don't go through Google unnecessarily. I understand you would like to know how your baby will look at 12 weeks, 14 weeks, how a lot of things there are a lot of knowledge there. But if you have anything, like medically something which is bothering you, or because when you go through your scan report, don't back and Google it. Instead, come to your doctor, ask your doctor. Your doctor will provide you with appropriate information what you are supposed to know. Unnecessary information is going to eat up your mind. It's going to put unnecessary thoughts inside your mind, and you're going to be really scared throughout your pregnancy. And your doctor has to spend more time in giving counseling. That's okay, spending time in counseling, but then some minds will accept it, but some minds will keep on thinking about unwanted things. So come with a fresh mind. Please don't Google unnecessarily. That is definitely I wanted to tell all my patients. And coming to clothing and footwear, clothing, as far as like now there are a lot of maternity clothing available. See to that you wear loose, comfortable, something like which is made up of very soft materials, particularly cotton clothing. Your underwear should be appropriate. It should be in appropriate size. It should not be too tight. So you can wear those type of clothes. So whatever clothes you are comfortable, whether it's a jeans or sari or salwar, see to that it's not very tight, and it is made of cotton, should be really good. Apart from that, when it comes to footwear, all of us are fashion conscious. I understand that, but when you wear, like something uncomfortable, or something like a high heels or something, there are chances of like ankle twist. You can twist your ankle, and you can be immobile for some time. So the accidents tend to happen if you have a fall. Definitely, there are chances, like your placenta can be separated little earlier. So avoid high heels throughout the pregnancy. If you want to wear flat heels, also please be careful about it. So selecting your footwear during pregnancy is a very important thing. This I'm telling to avoid certain unnecessary incidents that happen because of just the fashion conscious need. So just be careful with that. And I think I've covered most of the points. And in the final trimester, make sure you take necessary information from your doctor, when to reach your hospital, when, like how to count the baby movements, whether what are contractions, what is leaking, what type of bleeding you should go to hospital immediately, and see to that all your what all should be packed, all these packed and kept ready. All these things should be. You can ask us all these things to your doctors and keep everything ready. So make use, make use of your doctor to ask whatever questions you want to ask them, instead of asking, like a computer or Google. So to have seamless pregnancy, it's very important, to summarize, to plan a pregnancy, to visit a doctor immediately once you plan a pregnancy, to visit a doctor immediately once you become pregnant, and concentrate on your diet. In your diet, be natural. The more and more you're natural, you can even prevent diabetes, you can prevent obesity, you can be even more fit. And drink plenty of fluids. Avoid smoking, not avoid, completely avoid, say no to smoking, drinking, and any type of substance abuse. Take your supplements properly, don't miss even a day, and don't miss your doctor's visits, your scans, your blood report, when your blood tests. And apart from that, do proper exercises. Don't miss your exercises. If you want, go to an antenatal class and do exercises, do yoga, everything, and ask your doctor when you need to go to a hospital if you are in the third trimester. I wish you all have a very happy, healthy, and seamless pregnancy. Thank you.